This is a short film about mindfulness meditation and how it can be hopefully helpful to people who have diabetes. For those of you that don't understand the concept of mindfulness meditation, what it basically means is being in the present moment as if your life is depending on it. Mindfulness helps you as far as having more awareness, acting in a more emotionally intelligent fashion so that you don't simply react when you're angry or in haste or in autopilot. And it also helps you to just have more of a joie de vivre for life, more of a calmness, and more of a opportunity to be in the present moment. So much of our life is consumed with regret or thinking about the past, and so much of our life is consumed with making lists and planning about the future and worries about tomorrow that we really miss out on the present moment. So mindfulness meditation helps you to be more aware of the present moment. So how is that helpful for people who have diabetes? It's been my hope that this type of programming would be helpful for people with diabetes to help them to have more control over their diabetes, also to be less angry and more accepting of living a life with a chronic illness like diabetes. Also helpful as far as even possibly reducing glucose levels for people that have diabetes. So we've been doing mindfulness meditation for people affected with diabetes at the Health Sciences North for the last couple of months. And I pulled together a group of some participants who are here today to basically discuss whether they have found mindfulness meditation to be something that's helpful with their diabetes in their personal lives or something that's not helpful. And so what I'm going to do is go around the room and have each of the people that are here today have an opportunity basically to tell their story.
I've had diabetes now for going on 45 years. First time I was diagnosed, I had gestational diabetes, went away, came back every time I got pregnant. And throughout all the years that I've had diabetes, it was like, oh, it's there. What do I do with it? No, I don't have it. Why me? And I was in total denial, and I started taking these mindful meditation groups. This is my second time. The first time wasn't too bad, but this time I've learned a lot. I've learned to just slow down and think about what's going on in my life. I've taken my diabetes a lot more seriously. I test 6-7 times, maybe more a day, whereas before I wouldn't. And my numbers have come down quite a bit. They've really come down quite a bit. I notice what's going around me, whereas before my life would be just like I was in a racing car, and everything would just fly by and I never knew what was there. Now I notice the birds if we go for a drive, or I notice different sounds. And it's helped me a lot with the problems I've had with my children. I've learned this is what they want. They do what they want. Fine, I have my own life. I'll live it the way I want it. And it's helped me quite a bit, because when I stressed out a lot, my blood sugars would be higher. And now, okay, things do bother me, but I'm a lot calmer than what I ever was. And my numbers are a lot lower.
I am an insulin-dependent diabetic and have been for a long time. Because I have taken insulin for so long, I've been on the older types of insulin that were injected by syringes, and my types of insulins were never changed. I started running into trouble with that, and started running into trouble with my feet, and was directed to the diabetes center, which has helped me an awful lot. This course was suggested to me because I tend to take everything on. I'm the list maker. I'm the one that thinks that, oh, you know, what do I have to do on Friday when it's only Monday? So I thought that would be a good idea. But when I looked into this course, mindfulness meditation more, I thought perhaps it can help me where I really need the help, and that was with pain management. And I've come for 2 sessions, and both have helped me. It hasn't alleviated any pain, but it has helped me manage the pain because the other parts of my life are a little bit more centered, and I've put some priorities in order that should have been put in order a long time ago. And I'm looking after myself better because of the mindfulness. I do try to meditate every day. Sometimes it's only for 5 minutes, sometimes it's for 15, sometimes it's for almost an hour. But I do try to do it every day, and I do find when I do meditate, it does help my day, it does help the pain.
At first, I was in denial for quite a few years. I just did what I had to do for my diabetes, take my medication, try and watch my diet, and do some exercise. And this last year, I've had to get more serious about my diabetes because I'm getting older. I've had to take insulin for the last couple of years because of kidney stone problems and infections there. And so now, in reading up on taking insulin, I have to try and work my way out of getting off it if I can. And so I've come to the diabetes clinics here, and all of the personnel have been very helpful. And mindful meditation came up, and at first I thought, oh, it's a lot of poppycock. But, you know, everything else has been helpful. Why not try it? And so I have. And I have enjoyed the classes. It's helping me calm myself down when I get stressed out. It helps me at nighttime when I can't sleep. I go into meditation just to calm myself down, calm my body down, and first thing you know, I'm sleeping. And I have a good sleep. I really appreciate the classes now after I've taken them, and I certainly recommend anybody that's having problems with their diabetes or controlling it or denying it to take the mindful meditation, because it really helps you calm down, take perspective of what you're dealing with, and helps you carry on.
I'm a newbie with diabetes. I was diagnosed December 2012. It was a bit of a shock. I was angry, I was resentful, hated the world, just wanted to commit suicide basically by food, just letting myself go. And then I was referred to the diabetes center here and spoke with Gary. I started meditation. I was kind of leery of it. My first class, I was quite scared. I wanted to rush out. I was on high gear constantly, high gear. My pace I walked, the way I talked, everything I did was in high speed, and I had great difficulty coming back. So I spoke with Gary quite a few times. It was quite helpful. He gave me a CD to do it at home because I had become agoraphobic, couldn't go out, couldn't speak with people. And I started listening to the CD, and I've never went past, I don't think, 3 minutes that I've fallen asleep because my mind raced so much I could never sleep, which was part of my issues as well. But now, after not even 2 minutes, I'm out like a light, don't wake up all night. Now I'm able to talk. I'm here with several people, which is something 4 months ago I could not have done. I'm doing it without crying. which is something I couldn't have done. My life is slower. I'm enjoying today, not so much regretting how I got to the diabetes, why not, and tomorrow's another day, but today is today.
Thank you for coming here today and sharing your poignant stories about mindfulness meditation and how it has been, I'm thinking helpful to your lives. Helpful as far as being less reactive, making some important decisions, taking better control of your diabetes, and just empowering you as human beings. I'm also thinking that the programming has been helpful, and we all know that attending mindfulness meditation sessions is much more than simply coming for 8 consecutive sessions. It entails being aware of the moment every day, informally, but also doing formal practice. So I commend you with your efforts. I'm proud of you for your accomplishments, and I thank you for your participation today in this short film. Thank you.